Welcome everyone, my name is Brett Sinclair and I'm a student at the Central Queensland University of Australia. Today we're looking at the effects of resistance training on lower limb muscle activity during stable and unstable conditions. So instability training is exercise that incorporates the use of Swiss balls, Bosu balls, wobble boards and other unstable platforms. It's very commonly used in gyms, fitness facilities, and they are used to vary the degree of difficulty of an exercise. Very commonly used in rehabilitation facilities for neurodevelopmental purposes. Physiotherapists have used Swiss balls for neurodevelopmental treatments prior to the Second World War, and still very commonly used to strengthen neuromuscular communications. The rationale behind this is that instability training puts the nervous system under a greater workload, and this increases muscle activity, thereby promoting neuromuscular communication. Okay, so the available literature states that it strengthens neuromuscular communications, enhances core stability, and improved core musculature. Also states that instability training strengthens the surrounding tissues around the joint, therefore making the joint more stable and less prone to injury. A lot of the previous literature looking at lower limb muscle activity has shown no significant increase in lower limb muscle activity during instability exercise. But there has also been reports of increases in lower limb muscle activity during instability training in the lower limbs. And more conflicting, it even says that there has been reports of decreased muscle activity during unstable conditions. Okay, we hypothesise that instability exercises are more physiologically demanding than stability exercises, therefore a higher level of lower limb muscle activation will be required while performing these exercises. Okay, for this experiment we used 14 asymptomatic students from the Central Queensland University. All the students were part of an exercise and sports science program. There were 8 male and 6 female. Average height was 1.74 metres high and average weight 81.46 kilograms. Okay, so no one's shown any medical conditions that would affect their balance or mobility, so neurological or vestibular disorders. Everyone was very healthy. Okay, we used the Delsey's Bagnoli 8 EMG system. We used 4 out of the available channels to measure lower limb muscle activity, and what we were looking at with the lower limb muscle activity was the actual peak in the EMG data. Okay, so the first channel was hooked up to the vastus medialis, the second channel we used was hooked up to the biceps femoris, the third channel was hooked up to the gastrocnemius, and the fourth channel was an earthing electrode, and it was placed over the patella. Okay. Our testing conditions, we were doing single leg lunges, performed in 2 different testing conditions. So we were looking at stable conditions versus an unstable condition. For the stable condition we used a 60 centimetre high chair. Our non-dominant foot was rested on the chair. And for the unstable condition we were using a Swiss ball, and again the non-dominant foot was rested on the Swiss ball. I'll go back to this. For each repetition we were splitting our repetitions, so we'd go 1 stable and then 1 unstable, and 1 stable, 1 unstable, and each repetition required the participant to flex the knee so that the undominant knee was approximately 1 centimetre away from the floor, and then back up. And each repetition consisted of a 1 second down, a hold for 1 second, and up for 1 second. Okay, so to investigate any changes in the lower limb muscle activity, we used a repeated measure crossover design with two different testing conditions. When we got our EMG data, we used paired t-tests, and the statistical significance was set at 0.05. Okay, so 2 of the 14 data sets were removed from statistical analysis due to incomplete EMG readings. It's shown that the vastus medialis and the biceps femoris, there was no significant difference in muscle activity between those two muscle groups. But the gastrocnemius, it did show a significant difference. Okay, so I just said then there was no difference in peak EMG between the vastus medialis and the biceps femoris. This could be put down to participant familiarisation. All of the students that participated in this experiment were very familiar with the exercise. Plus there was no additional bearing of any sort of weight, so being so familiar with this exercise without any additional weight bearing might not have been enough to increase any lower limb muscle activity within these people. Yeah, it might not have been enough to stress the participant's nervous system because they were so familiar with that exercise. The EMG data from the gastrocnemius did show a significant difference in peak EMG between testing conditions. Okay, so during plantar flexion, the gastrocnemius is a prime mover, and during knee flexion, it is a syningeus muscle. Now, we didn't measure where during the range of motion the peak EMG occurred, but we can hypothesise that the peak EMG may have occurred during knee flexion because it is a syningeus muscle during knee flexion. Okay, this study did have some limitations. As I mentioned before, participant familiarisation may have been a limitation to this study. The very small sample size as well, and the use of electrodes to record the peak EMG. Electrodes are very, very prone to picking up on unwanted noise from electrical equipment or unwanted movements. We did try and minimise this by taping the electrodes down and actually using a compression sleeve to hold them in place, so hopefully that sort of worked and reduced any unwanted noise. Okay, so as I said before, rehabilitation facilities very commonly use instability exercises in their patient recovery programs to help strengthen the syningeus muscles of the lower leg and antagonist muscles. They believe that it enhances afferent neuron efficiency. However, there is not very much research available to back that up. There also has been reports that it improves the muscle onset latency, so how long it actually takes for the muscle to become active, which is interesting. Further research could determine whether unstable single leg lunges could improve afferent neuron efficiency and reduce muscle onset latency. We'll just go back to that. So we've found that during instability exercises, the gastrocnemius throwing out a higher peak EMG. It would be interesting to go with a longitudinal study with 2 different groups, one that were doing instability exercises and one that was not, and look at muscle onset of activation and actually see if the unstable single leg lunges could actually improve the muscle onset latency. Okay, in conclusion, unstable single leg lunges, it really elicits no significant increase in muscle activity of the vestus medialis or bicep femoris, the agonist-antagonist muscles during the squat exercise. However, the gastrocnemius muscle activity is increased while performing unstable single leg lunges. The agonist and antagonist muscles can work more efficiently when synergist muscles stabilise the knee joint, so that it can go through its full range of motion a lot easier. Okay, so the physiological demands of instability training requires a higher activation of synergist muscles for joint stabilisation. Okay, so unstable single leg lunges, not an appropriate training tool to elicit greater muscle activity from agonist-antagonist muscles. Does have a greater activation of lower limb synergist muscles, so it is a useful training tool when greater stimulation of the gastrocnemius is required. Thank you for your time.